are now listening to Extracting Wisdom. Here to help you prevent the decay of your future is your host, Brandon Evert.
Hello, everybody, and welcome back to another episode of Extracting Wisdom. I am your host, Brandon Evert, and this is the second installment of the Clinic Transition mini-series, which aims to help fellow dental students with their transition into live patient care and to open up a discussion about how to effectively manage patients. My goal, and I hope it is your goal as well, is to be armed with as many pearls, tips, tricks, skills, techniques, whatever you want to call them, in order to run my future practice like a boss. And in order to run your practice like a boss, you have to start developing these skills now. If you missed the last episode, go back and check out episode number 60, which focused on calling and scheduling patients. Today's episode is going to be focused on talking to patients face-to-face and how to avoid using dental jargon and how to navigate treatment plan presentations. So let's get into it. But first, it's time for a new segment of the Extracting Wisdom podcast I like to call Extracting Wisdom MCQs. As I get closer and closer to studying for board exams, I thought it'd be a good idea to do a multiple choice question at the beginning of every episode, so we can go ahead and study together. So, the question for this week is, if a patient requires antibiotic prophylaxis prior to dental procedures, but is allergic to amoxicillin, what is the go-to antibiotic of choice? We have A, sulflexin, B, augmentin, C, clindamycin, or D, metronidazole. I'll go ahead and give you some time to think. Okay, so what do you think the correct answer is? Well, the right answer is C for clindamycin. So let's go through each of these. Sulflexin belongs to the drug class cephalosporins, right? Which is a beta-lactam antibiotic. Penicillins are also beta-lactam antibiotics because they both inhibit cell wall synthesis. So there are studies that show that if a patient is allergic to penicillins, there may be cross-sensitivity to cephalosporins. So this wouldn't be the next best choice. Augmentin was meant to trick you because it consists of amoxicillin and clavulanic acid. So you're not going to give this to someone who is allergic to penicillins. Answer C is the best answer because it is not a penicillin. It has a different mechanism of action, which is to inhibit the 50S ribosomal subunit to inhibit bacterial protein synthesis. The typical dosage for clindamycin is 600 milligrams, about 30 to 60 minutes before the dental procedure or appointment. Finally, answer D isn't necessarily the best choice because metronidazole is a more narrow spectrum drug that acts on anaerobic bacteria. For prophylaxis, you would probably want something more broad spectrum to cover all your bases. So, if you like this new format and like the multiple choice questions, send me a message and let me know. You can email me at Bevert.dental@gmail.com, which is BEVERT.dental@gmail.com, or you can send me a direct message on Instagram at BrandonEvertDMD. And with that, let's go ahead and get into the episode. So I'm going to start with what I think is the most important point of this episode, and that is to avoid dental jargon when talking to your patients. You might think that using all these big fancy terms when you are talking to patients make you seem smart and confident, but in actuality, patients usually don't care about these terms and don't care what they mean, and in using these terms, you are actually creating a disconnect between you and your patient. The whole goal of your conversations with your patients is to gain their trust and to educate the patient and give them a good idea of what is going on inside their mouths. And you telling them that they have symptomatic irreversible pulpitis with symptomatic apical periodontitis isn't going to help the patients understand what is going on. So you have to separate the way you talk to your faculty and other dentists and the way you talk to your patients. So let me give you a quick example. Let's say you are doing a composite restoration and you just finished your prep and you notice some discoloration. Are you going to tell your patient, hey, I see these dark spots on the pulpal floor of the prep. I'm not quite sure if this is tertiary dentin or active caries, so I'm going to go ahead and use a slow speed and see. Or something along those lines. The patient doesn't know what the pulpal floor is. They don't know what tertiary dentin is. They don't care. All your patient knows is that they are in your chair and they are getting a cavity filled. So a much better way to convey this or to express this to your patients is something like, hey, it looks like there might be a little bit more cavity left. I'm going to go ahead and clean that out for you. It can be as simple as that. And that's something that your patients can understand clearly and easily. So start thinking about simple terms that you can use to replace all of your dental jargon that you know. Here's another good example. Don't ask your patient, hey, do you see this radiolucency right here when you're looking at a radiograph? Okay, and say, oh, that's a cavity. Say shadow instead. Keep things simple. And I truly believe that if you can explain things in simple terms, patient understanding of whatever's going on inside their mouths dramatically increases. And this will be really important when you start talking about treatment plans with your patient, which we'll get to at the end of this episode. And while I'm on this point of word selection, patients are much more at ease when you use less threatening words, right? This seems pretty obvious. And I don't think patients are going to be too excited when you tell them, hey, I'm going to inject you with 2% lidocaine, and then we're going to go ahead and use the drill to cut your tooth so we can put a crown on it. Words like these will increase patient anxiety and make the procedure seem even worse than it actually is. So put your patients at ease. You want them to be comfortable. They know they're going to be numbed up. They know you're going to be using the handpiece. So when you speak to them about the procedure, use less threatening words. It makes the procedure seem much more routine and less of a big deal because it's not a big deal. You do this every day, and that's exactly how you have to approach this. And this is especially important when you're treating pediatric patients. And I guess while we're on this topic, I'll go ahead and share a technique that I just picked up and kind of put my own spin on for when it comes to numbing up peds patients, because I know this can be a very difficult thing to do, especially on patients that have to come in over and over again because they need a lot of work. Because I know we've all been there. We have kids terrified of the needle to the point where they will kick and squirm and scream, and it's almost impossible to get any work done. But if we can get profound anesthesia, the kids become so much more compliant. Well, maybe not so much more, but they become more compliant, and we can get what we need to get done. All right, so here's my technique, and it usually works really well. You tell the kid that you're going to spray some really cold water in their mouth. And you say, don't worry, it's going to be so cold that it might sting a little bit. It's going to be really, really cold water. So you have an assistant or a classmate spray water at the injection site and be suctioning at the same time. And then you inject right into the water. And this is after you've done topical, of course, but the patient doesn't even know that you are poking them with a needle because you kind of set that expectation that they might feel a little discomfort or that stinging from that cold water. And they might not even realize that they've been injected. And this is going to allow you at the very least to get an initial injection to numb the area. And it works pretty well. So even though you might have to go back and do a second injection if they're not all the way numb, this at least helps you get part of the way there without them even realizing it. So go ahead and try this technique out and let me know how it goes for you. So we've talked about eliminating dental jargon and threatening words. The last thing I want to talk about really quickly is treatment planning. And again, this comes from my somewhat limited experience. So if you have other techniques you use or anything you want me to bring up in the next episode, please send me an email or a message and let me know. But my main point that I wanted to mention in this episode is when I'm walking through my clinic and I see treatment plans being discussed with patients, I see very little use of visual aids. And I always think, how can a patient understand what you are talking about and make a decision about which treatment plan to pick if they can't see or have an example of whatever treatment you are talking about? And I think that models, pictures, examples, whatever it may be, really complements what you are saying to your patient. And I get it. If you don't have your own models or you don't have access to models to you at your school, it may be difficult. But if you have models, I really encourage you to remember to use them and to sit down with your patients and show them, because I really think that it helps increase treatment plan acceptance if the patient can see what you are going to do in their mouth and understand why they need it done. And what if you don't have any models? Here's a super easy solution that works almost just as well as models, is you ask your friend Google to pull up some pictures for you. Okay, this works just as well. There's a lot of different pictures of the same thing. You can find the best ones and kind of create a collection of these pictures. But you can also even open up YouTube and find some good animations to show your patient. If patients understand and are able to see and touch what you are going to put into their mouth, whether it's an implant, denture, crown, bridge, whatever, they're going to be more likely to accept the treatment. So next time you are about to present a plan to your patient, make sure you have models and pictures ready to go to show them. And one more thing I'd like to add before I start wrapping up this episode. I know this is a short one. They're meant to be short. So you guys can listen to these very easily and hopefully pull away a pearl or two from this episode. The last thing I wanted to bring up is talking confidently to your patients. Don't be timid or shy or seem like you don't know what you're doing. Even if you really have no idea what you are actually doing, which a lot of the times, let's face it, that happens in dental school. It does, where you might not feel confident about something, or you're not sure what the next step is, whatever. Approach it with confidence anyway. Why? Because 1, it will make your patient seem less anxious and trust you. And 2, confidence is key in the clinic for your own sake. Okay? If you aren't confident going into a procedure, you're going to be timid and take forever, and you're going to have to reduce that crown prep occlusally over and over again, and your patient's going to start looking at their watch and asking if they're almost done yet. As opposed to being confident, and you can look at your prep and know how much reduction you need left to go. You make a depth cut to that depth, and you get it done. Okay? That is going to help not only move appointments along, but it's going to increase the quality of your work as well. So be confident, but not cocky. Walk with confidence, talk to your patients with confidence, and approach a procedure with confidence, and you're going to have a lot more success in clinic. So I will go ahead and leave you with that. Thank you so much for tuning in to today's episode. If you want to be a guest on a future episode, please reach out to me on Instagram at Bevert.DMD or email me at Bevert.dental@gmail.com. That is Bevert.dental@gmail.com. If you enjoyed this episode, please give this podcast a like or 5 stars or a rating on whatever platform you are listening to. I really appreciate it. Thank you again for tuning in. I will talk to you in the next episode. Take care, everybody.